Good morning, everyone. My name is Bernie Robinson, and I am the interim president of the Ontario Nurses Association. I am very proud to be here today with all of our allies to present this Christmas card to our Premier. We represent ONA, 68,000 frontline nurses and healthcare professionals, and 18,000 nursing students across this province. The vast majority of our members have been affected by Bill 124. Our healthcare system is collapsing. There's no end in sight. Emergency departments are closing all across the province, surgeries are being canceled, and children are unable to be admitted to hospital when they need it because of the shortage of staffing. Ontario's nurses are tired, stressed, and overwhelmed with the serious staffing shortage, the negativity, and all of this is impacting patient care. There was a glimmer of hope, though. When the court decision on Bill 124 was announced in November, nurses and healthcare workers were overjoyed. We were finally vindicated, seeing this terrible legislation struck down. Nurses cheered and literally breathed a sigh of relief. Relief that we can finally seek the wages we are owed. Relief that our 3-year fight for fairness and respect was a victory. Unfortunately, this relief was short-lived. The Ford government quickly expressed their intent to appeal. Nurses went from relief to outrage. We are angry, we are frustrated, and we are saying enough is enough. We urge the Ford government to do the right thing. And the right thing for nurses and healthcare workers and all public sector workers is the right thing for patients and Ontario taxpayers. Do not appeal the court ruling. Bill 124, no more. The Premier must stop attacking workers. This is vital. The Premier must stop targeting female-dominated professions like nurses, healthcare workers, and teachers. The Premier must not move forward with an appeal. It's time for our Premier to do the right thing and to stop this appeal. Thank you.
Excuse me. Good morning. My name is Michael Hurley, and I'm the president of CUPE's Ontario Council of Hospital Unions. And we're here today to deliver a postcard to Premier Ford. I doubt he's going to come down for it. He's been asked to, but it says, "Dear Premier, do not appeal Bill 124." And we're delivering this on behalf of the 295,000 hospital workers, healthcare workers that we represent in Ontario. People who've worked tirelessly through the pandemic. We have a government that denied that COVID was airborne, withheld vital protective equipment from these workers. We have a hospital system which has 33,000 vacancies and turns over 15,000 positions a year, according to the Canadian Institute for Healthcare Information, which is causing a staffing crisis, which is causing a capacity crisis in our hospitals, and it won't be remedied as long as the staff are treated without the respect that they deserve. The courts have spoken on Bill 124. The bill has been found to be unconstitutional. It is our expectation that now the government will respect the court decision and will not appeal, and that's certainly the intent that we have as we present this card to the Premier and to his cabinet today. Thank you so much.
Good morning. I'm JP Hornick, President of the Ontario Public Service Employees Union. I stand here today speaking on behalf of OPSEU SEFPO's 60,000 members working in healthcare and our 180,000 members across this province in the public service. It is clear to see the damage that Bill 124 has done to the healthcare system. The impact will be felt for years. It has taken a crisis and made it into a collapse, as Bernie mentioned. By overriding workers' charter rights, healthcare workers and their unions were unable to bargain fair wage increases. These increases could have retained healthcare workers in the system, and they could have helped recruit new workers. Wages have now fallen well below inflation, skilled healthcare workers have been pushed to their limits, and 81% of Ontarians in a recent survey say that wage caps on healthcare workers should not have happened. The stress has forced them to consider whether unfair compensation is worth their own health for these healthcare workers. The system is hemorrhaging, and the result is a feedback loop that demands more and more from fewer and fewer workers. Healthcare workers are not leaving because they no longer want to help people. They're leaving because a single person can only bear so much. Patients, including sick children, are flooding emergency rooms with viral and respiratory illnesses, waiting for test results, for beds, for care. Strong public health care means the full arc of patient care must be properly funded and properly resourced. Having the staff and equipment to diagnose illnesses in time can be the difference between life and death. And yet, instead of making the necessary investments, the Ford government is underspending by almost $900 million a year. These are deliberate choices made by this government to target workers rather than invest in health care. These choices have been made over years. They can no longer blame the previous government because they are the previous government. What they need to do is to stop attacking workers. There is still time left to make different choices. Stop the appeal of the Bill 124 decision. Invest funds in public health care. Put the focus on staff retention to solve the crisis. That is why you see our 5 unions here today in solidarity. This is why we have come together. Our members work every day to provide Ontarians the quality health care that they need. Our members need a government that is in their corner, a government that will work with them on solutions instead of fighting them in court. And that means no appeal to Bill 124. It means negotiating, not relying on a courtroom to continue targeting women workers. You cannot claim to be working for workers while taking us to court. Today, healthcare workers across Ontario are making a statement in their workplaces. Bill 124, no more. Enough is enough. Doug Ford has over a week left to stop the appeal of the Bill 124 decision, and it is time for him to make better choices. It's time to listen to healthcare workers and work with them to fix Ontario's healthcare system now. Thank you very much.
Good morning. My name is Jackie Walker, and I'm the Nursing Division President at SEIU Healthcare. I'm proud and pleased to be here today with the 5 largest healthcare unions in Ontario, representing over 295,000 workers. I'm also very proud to be here with my sister Donna Thomas, who is a PSW, a personal support worker from a Toronto area hospital. Now, for Donna, Christmas came a little early this year, but it all went away very soon when Doug Ford announced that he would be appealing our victory that we fought for collectively as unions against Bill 124, which is an infringement of workers' rights to freely bargain and collectively negotiate an agreement. This was struck down by the Superior Court because it was anti-worker, anti-woman, and racist legislation that was deemed unconstitutional. Officially, the Supreme Court declared it is null and void. It was a victory for all workers and a strong message to future governments to keep your hands off of our rights. In just 5 days, it'll be Christmas for some. Healthcare workers are tired, are suffering from moral injury, and we need a hand up. But instead of the calm, healthcare workers are experiencing crisis because the current plan, the plan from Doug Ford's government, is failing. It's failing workers and patients alike. We're practical. I mean, I'm a practical nurse. And our healthcare unions have come together to offer solutions that would relieve the pressure from the front line, that would help boost frontline staffing and relieve administrative pressures, and ensure the investments in healthcare go to people, not profiteering. But these proposals must begin with respect. And that's why we're all here today. Because when you take away the rights of workers to freely, collectively negotiate and bargain, you take away their voice and their spirit. And this Christmas, Premier Ford might actually break the spirit of healthcare workers by appealing our victory and using taxpayers' dollars to fight healthcare workers in the courts just so he can reinstall Bill 124. In 2021, Premier Ford asked our unions and asked the unions a series of questions in the lead up to vaccine mandates. We took these questions, his questions, to our members, workers in healthcare. And what healthcare workers told us was that poor wages and dangerous working conditions were the biggest drivers out of the sector, not mandates. In fact, for every one worker who said they might leave because of mandates, 20 workers said they would leave because of poor working condition and low morale and low wages. It's simple. Workers want economic security, and Bill 124 is an anti-worker, anti-woman, racist policy that robs people from the opportunity to get ahead and stay ahead. There's a reason why Ontarians tell pollsters that they want Prime Minister Trudeau to hold the line on accountability and better outcomes in exchange for new federal dollars to healthcare. That's because the people of Ontario know that the PC plan for healthcare is failing. They see children's hospitals closing. They see cancer surgeries being cancelled. We're here to remind you, Premier Ford, when you attack workers, you attack the care they provide to Ontarians. The consequences are predictable. Longest wait times in Ontario, with the largest amount of vacancies in healthcare. We need to reverse this harm. You need to reverse this harm, Doug Ford. We're here to say Bill 124, no more. And that's all workers want for Christmas. Thank you.
Thank you and good morning. My name is Noreen Rizvi and I'm the Ontario Regional Director for Unifor, elected to represent the interests of our 160,000 members right here in Ontario. That includes members working in a wide range of public service, including 27,000 members in healthcare. We're all here together today urging this government to listen to Ontarians and healthcare workers and accept that Bill 124 is no more. Instead, they need to focus their energy on the urgent action that's needed to address our healthcare crisis. We continue to see emergency room closures, long wait ER times, and canceled surgeries. Children's hospitals are overflowing, and because of the overcrowding, patients are being transported far away from home to receive care. And the only response from the health minister about sending children to faraway hospitals is that it's not ideal. Healthcare workers are burnt out, overworked, disrespected, and underpaid. That is why we are seeing a mass exodus of healthcare workers. 70% of RPNs say they can't provide adequate care for patients due to insufficient time and resources. 70%. Nearly 1 in 2 RPNs in this province say they're considering leaving the profession. The number of nurses in hospitals quitting has doubled in the last 5 years. That is during Doug Ford's tenure. And frankly, hospitals are struggling to retain all types of workers right now. This government is doing nothing to deal with this crisis. We've all seen the recent Angus Reid poll, where 81% of Ontarians say that Doug Ford is doing a poor job on healthcare. Instead of actually tackling this crisis, the government wants to waste more public money to fight the court decision and to try to restore a piece of legislation that tramples on our constitutional rights. Perhaps we should poll Ontarians on whether they want their tax dollars used to fight healthcare workers in court instead of putting money back into our flailing healthcare system. Let's be clear. Bill 124 helped create the staffing and healthcare crisis we're seeing right now. And things will continue down this path if this government continues to fight the court's decision. Bill 124 is no more. We are not standing down. We will continue to fight for those healthcare workers who have remained in our system, and we will continue to fight to protect everyone's charter rights. Ford has absolutely failed Ontarians, failed our healthcare system, and failed our healthcare heroes. Our unions are here together to say, enough is enough. We need real action. Bill 124 is no more, and you need to accept the court's decisions. Thank you.
This is my time to shine. Merry Christmas, everybody. Thanks for being here. Someone might be able to explain this for me. I don't know who it is, but I'm just hoping that somebody can lay out the timeline from here forward, such as when you're waiting to hear back about if the government is going to take this to the Supreme Court, and then as well from there, what's your impression of, again, if they do appeal, when that appeal will be heard, and when you can expect a verdict to finally end this saga. So, whomever might have that information, it'd be lovely to hear from.
Our understanding is the government has 30 days from the court decision to launch an appeal, and both the Attorney General and the Premier have said verbally that they intend to appeal, but as far as we understand, the paperwork has not been filed with the courts. We don't believe that an appeal could be heard before the fall and possibly into early 2024. And a government which appeals to the next level, the appeal court, will likely appeal to the Supreme Court, in which case these workers, having had a successful decision from divisional court in November, will be in a position where they'll wait 5 or 6 years for an outcome. And we're saying that that is profoundly unfair, punitive, and it desperately needs to be reconsidered by a government that should be focused on how it's going to retain staff and keep them working. Is that?
Okay. Yeah. That's very helpful. And I guess sort of in the same line of thinking, at whichever level that this reaches in the court process, if all of you are successful and this bill is, I guess, ruled to have never taken effect, how long will it be before you, I guess, I would assume you would be suing the government for lost wages and whatnot? Does anyone know the answer to that question? Or is that getting too far ahead of ourselves?
So I can speak for ONA. ONA definitely has reopener clauses from our last collective agreements that were negotiated, and we will be seeking to have those reopeners instituted and hopefully have fair outcomes from that.
Okay. And it was a few weeks ago, I believe, that the Premier said that Bill 124 would not be something that would have the notwithstanding clause applied to it. Does that give anyone here comfort? Do you believe him? Again, open floor for whomever wants to answer that.
The greatest comfort from this government would be to not appeal Bill 124. Justice Conan was very clear that Bill 124 is null and void as of right now, and we're proceeding accordingly. So the easiest thing to do to give these workers comfort, to actually invest in our healthcare system, is to drop any sense of an appeal of Bill 124 and to proceed fairly by bargaining with these workers as they deserve, to actually pay them what he says they're valued for, to stop profiteering within the public healthcare system. If I were to find comfort at all in this government, it would be through gestures of goodwill, like dropping the appeal of a bill that was already found to violate charter rights.
Okay. And over the years, at many of these press conferences, I have never seen police unions, firefighter unions here with you all. Have you at any point reached out to these groups? Obviously, Bill 124 does not apply to them, but I'm just hoping somebody can explain to me why, why they haven't shown support to you. Because logically speaking, with the reasoning the government gave for introducing this bill, it could be applied later down the line to those types of workers as well.
Well, the the Ontario Federation of Labour issued a very supportive media release this morning. The other unions are quite supportive of our efforts, but for our 5 unions, our immediate focus has been to unite our memberships and to bring together all of the healthcare workers that we represent to campaign together for fairness and justice. And as that campaign ramps up, I think you'll see other unions fold in with concrete support, particularly as things like demonstrations become manifest. So, yeah, all the unions are supportive to the best of my knowledge. Yeah.
On a different topic, JP, I want to ask you about the new Toronto Police Chief. I'm sorry you're here. I must ask. I think it was yesterday he was sworn in. I'm just wondering where things stand in terms of the ask to get him to meet publicly with, I believe it was just members of the LGBTQ community.
That's a completely separate side gig. But what I will say is that I think what we see here is a trend towards politicians needing to be responsive to their constituents and their communities. And when I'm looking at the processes that underlie that appointment, we're seeing the same lack of consultation, the same lack of direct dialogue with people who are impacted by the decisions that are happening at these levels, whether it's municipal, whether it's provincial. The strong mayor's powers that were introduced at the request of John Tory are an indication of the same kinds of intrusions into democracy and a trampling of rights that we see with Bill 124. So what I'm really invested in whatever role I've taken on, it is making sure that workers, that communities, that Ontarians are actually getting the best representation from politicians, that our frontline services, our frontline workers are having their politicians walk the talk. You can't tell people that they're working for workers. You can't tell people that healthcare workers are heroes and then take away charter rights. You can't appoint a police chief who then tramples on rights. So if there is an opening for conversation and dialogue, then I think you'll find that every leader up here will take it. But we will fight for our workers because we are fighting for Ontarians in those cases.
That's all for me. I don't know if there's people on the phones, but I'll defer to the big man upstairs.